we have like almost the largest number of young people in India today, right? We have the capacity to shape, in a sense, the human capital for the future. Social media is the cause of a lot of misinformation, but it can also be the source of information. School kar liya, theek hai, at least 12वीं pass to hai. But that's not enough. And I think that transition from school to college and from college to workforce, that is so important for girls today. When women are interacting with health systems, they need to be heard. Firstly, they need to be heard with respect. There's a husband, there's a mother-in-law, there's sort of an extended set of relatives. Everybody takes that call on whether this woman should be having a baby or not. But does the woman have that choice?
Thanks a lot, Nandita, for joining us. And let me just start on a personal note first. That what inspired you to pursue a career in, say, gender studies and health? And I mean, it's a combination which nobody talks about so much.
No, so actually, I didn't come into public health through a normal route, which is I'm not from a medical background. My first degree was actually economics. And I always knew I wanted to be in development, but what in development I was never sure about. And it was actually a few chance experiences, I would say. It was a field project that I did in Himachal, which was on decision making women in reproductive health. And I kind of embarked on that project as more of a fun activity than a serious one. But it really sort of triggered something in me. It really invigorated this desire to know more. And I would say that was a starting point, but I kind of knew I didn't have the training to do this work as much. And it was then meeting Professor Srinath Reddy, who had just started the Public Health Foundation of India. And I think he's been a mentor for so many of us. And meeting him and knowing that he wanted to create a cadre of public health professionals who came from different disciplines, right, and who were also interested in working and staying in India. So I kind of met him, and it was that meeting that sort of again then propelled me on to get training. I think after that it was being able to go to Harvard, and I think that in a sense laid the foundation for a lot of what I do today in terms of I mean, obviously Harvard is amazing, but what it teaches you the most is that you need to strive for excellence in whatever you do. You have to be the best, or you have to at least try to be the best. And that was there. And then I feel like there are other mentors in my career. My PhD professor at that point, he was a brilliant person, but one person or one set of experiences that really made it for me within gender and health was meeting Professor Anita Raj, who was my boss for a few years. And I think she really shaped me, working with her at the Center on Gender Equity and Health. I was there for more than 5 years, and I'm still connected with it in terms of the work that I do. I think it really trained me into not just a good researcher, but also how to be an investigator, how to be a boss, how to be, I guess, maybe some leadership skills as well. It was just very formative. So there were so many people, and I would say so many moments along the way that really set me on. And I think I'm very privileged to be working at OP Jindal Global University, which started a new school of public health, which is not just about a medical approach, but the school is called Jindal School of Public Health and Human Development. So again, I think that development part has been reinforced in the work that I'm doing so much. So I think there's so many things along the way that have really set me on.
You've talked about Harvard. I'll take a step back on that. And you also studied in Delhi University.
Yes.
Right. And focus on gender is not there as much vis-a-vis when we see the university. There, the spaces for women are less.
Right.
I mean, many of the colleges don't even have a girls' hostel. Right. So, I mean,
I think we need to do more. Yes. We need to do more.
So, I mean, has anything, say, in Delhi University or UCL also shaped your perspective vis-a-vis gender in public health?
Certainly. I think I studied economics. So gender studies is not really part of economics. In fact, I think labor economics, especially at the undergraduate level, barely touches on gender, which is, I think, the biggest issue today is, women being in the labor force, and we don't really study that as much. But I have to say that I do still feel a sense of gratitude, because I studied at a time where there were some remarkable people in the Department of Economics who really shaped me in terms of wanting to pursue quantitative methods, being trained to be able to do that, and studying with us. I mean, I was a bit of a nerd, so not a whole surprise there, but I think it really made me a sincere student.
Right.
I was in Jesus and Mary College. I was quite scared of some of my teachers then. I don't know if young people are as scared of their professors anymore, but it was a great time, and I don't regret it. I know I feel like we do need to get out of these sort of silos that we have, and we need to encourage more interdisciplinary work. And there is a Center for Women's Studies on North Campus and so on, but more needs to happen.
More needs to happen, and it's not just about Delhi University, but most of the campuses in India. I mean, now you have certain universities coming up with department called Gender Studies,
right?
But that's not frequently happening. Say, I mean, you might get it in Delhi, you might get it in Ambedkar University, you might get it in Jamia, but what about a university in UP or in
Not enough. And in fact, I really hope that state universities really step up, because, I'm sure we'll talk about this, but we have like almost the largest number of young people in India today, right? We have the capacity to shape, in a sense, the human capital for the future. And if we don't invest now, we're really not going to be in a position to reap the benefits even like 10, 20 years on. And so I think gender studies is a particular one that really needs to, it needs investment, it needs nurturing, it needs, certainly support from a host of stakeholders, yes.
So now, since you've raised an important point about the state universities, these state universities are also something which are basically influenced by the local politics and the society and the environment around us.
Yes.
The culture around us. I mean, what impacts do these societal pressures, cultures have on an issue like gender in India? And I mean, are there any concrete steps being taken in this direction to, say, correct it or rectify it?
I mean, I think there are a number of things that are happening or have happened. There have been efforts in that direction. But to your first sort of question, what sort of influence do gender and sort of the forces around gender have? I think that's like the most important question today, I would say. And it's a cross-cutting question that affects various sectors, not just education. Particularly in healthcare, we know that for a large portion of the country, we find that gender is often the most critical determinant of health and health seeking, in the sense that gender inequalities play out in almost any health issue that we think about today. And women's access to health and healthcare remains one of the most significant challenges. Women are equal citizens, not just of India, but globally, and they deserve to be heard almost on the same level by the health systems. So some of the work that's happening today, and not just by me, I think a host of other people work on this, is understanding how do health systems work with women. And I can tell you that some of the basic things that get studied are looking at disrespect, right? Now that might sound like, oh, is that a health problem? But it is. When women are interacting with health systems, they need to be heard, firstly. They need to be heard with respect. And how will you provide treatment if you don't hear them? I think there is work by people on looking at how there is disrespect in birthing rooms. Now, something that, when I tell my students, I have a women gender studies class, and when I tell my students, they're shocked. You would have expected women, when they're giving birth, to be at least heard, but they're not heard even there. So I think there are so many areas of work, so many areas and streams that need our effort to understand these connections better. Similarly, when it comes to women's right over their bodies, something that sounds like one of the most basic, like women's autonomy over their own bodies, right? But we know that when women take decisions around having children or not having children, there are so many other voices that sort of, are there. There's a husband, there's a mother-in-law, there's sort of an extended set of relatives. Everybody takes that call on whether this woman should be having a baby or not. But does the woman have that choice? So I think, these forces are really at play, and we try to unpack them in research. We try to make people understand them, common people, policy audiences. So often, one of the things that we struggle with is what is the right language with which to communicate with a policymaker, with the community. So we do all of that. So this is like a huge stream of work, and I really think that much more needs to happen. Of course, there are a few islands of excellence, but much more needs to happen more broadly on the same.
Right. So, you've talked about one of the important issues, which is like disrespect and women are not being heard.
Yeah.
So, when we see women, we have to see them vis-a-vis two categories also. One, you have women who are older women, right?
Yes.
And then you have adults and girls.
Yes.
Who, correct me if I'm wrong, but would have, say, much more less say than a woman who is grown up.
Certainly.
So, what kind of challenges they face vis-a-vis health when it comes to adults and girls? Because that initially pointed out, India has one of the youngest population.
Yes, I think we have over 200 million adolescents, right? That's a huge number. I can't even sort of make my head around it. But one of the real, I would say, remarkable things we have done, okay, because I think you had earlier asked me, and I don't think I answered that very well, but one of the sort of, or at least a couple of interventions that have really worked in India have been the focus that's happened to reduce child marriage or marriage of girls below 18 years of age. And India has done remarkably well. We have almost halved that rate from 2005 to now. Like 48% of girls, as per the NFHS, were getting married before 18 years of age, and now that rate is 23%, which is still much higher than it should be, right? But we have seen that through state policies, through incentives, so cash incentives to families, a lot of different streams, through social norm change, we have actually reduced that remarkably. Similarly, another thing that has really, I think we have managed to at least put a lot of girls through schooling and finish their schooling. I think the place where we need much more effort is now sending girls to universities, right? And making sure that they go from universities into the workforce. So there are gains. One of the real challenges for girls happens is the pressure to get married, right? And that might seem like that's not a health problem as well, but it actually is, because the pressure to get married is often also accompanied with the pressure to have an early fertility, like an early pregnancy, right? To prove their fertility almost. And so these are all changes that girls are facing. Another thing that I think that we probably need a lot more of is sexuality and sexual health in education. This is something that we've had, but it's sort of lost its steam. And I don't know if actually even boys should go through it, of course. But most schools sort of teach you menstruation and some very basic biology.
Or at max reproduction.
Yes,
that's one of the chapters.
Which happens in very, I would say, sanitized, constrained environments. But we don't really talk about, issues around, sexuality, mental health, consent. And we have a young population, so these are issues that should be on the table and should be, information is better than misinformation.
Right, but also adding to that point, not just students, but the teachers need to be sensitized that they have to.
Yes,
they need to.
Yes.
Not treat it as a stigma and
right,
just skip
or
through it.
sort of this sheepish way in which you kind of get through that session.
Yes.
I mean, that is certainly, we definitely need more teacher training, and for teachers to not just train, of course they know the basics, but to have the language to be able to impart that to a young person, because obviously we want to make sure that it's not something that's funny, titillatory in some sense, or even inappropriate. So it has to have the right language, and I feel like we've sort of lost steam a bit in the last 20 years on this. So we really need to kind of step up on that.
Sensitization needs to happen.
And it's not just for girls, trust me. I think boys need it also a lot more, because young people today, with the growth of media, and media is sort of, I would say, uncontrolled now. And there is no way that we can, in a sense, control what a person is accessing, right? So we have to make sure that at least they get some right information, no matter what else they are getting through media, young people these days are addicted to reels. And I'm sure they're of all quality, and some of it might be noise, but they need to get the right message in that sense.
So let me come back to different other issues. One, COVID has had an impact on women.
Yes.
Specifically.
Yes.
One, there's a loss in livelihood, which is very evident because people en masse had to move, and then women were most affected because of it. They were confined to their homes.
Right.
How has it, how do you see has it being impacting women's health? I mean, are there studies, research which shows that COVID has had an impact on women's health that much?
I think there are, but because data sources were limited, we had very few ways to know what was going on with COVID. But there are a number of studies and reports that show, one, that very rightly you said that it impacts people's livelihoods. A lot of women in India were doing domestic work, doing work that was sort of daily wage, kind of very informal sector. And you know how it shut down. So it directly affected them. Of course, the government tried to take as much measure as it could, but it was not enough. Secondly, I think another thing that happened to women, which we don't talk about enough, is that they sort of got confined within their homes. So there are studies that show that in that period, because of the wider forces, in a sense, of stress, anxiety, livelihood pressure, and then being confined within the home, there are some reports that there was an increase in violence against women.
Yes.
Right. So that was another element that we need to understand, and I hope that that has, again, violence against women is a huge issue. A third thing that I have often heard people say, and there are reports from this, is that because schools shut down, a lot of parents, particularly not in metros, but particularly in rural parts of India, felt that, well, schools have shut down, girls have nowhere to go, why not get them married? So there was a spike in a sense in child marriages or early marriages, not child marriages, but certainly earlier marriages than should have been. And so there are reports from various parts of India of increase in girls' marriages very early, sort of in early ages. So these are various things that need to be studied. Of course, thankfully, we've moved on and we've sort of got measures in. But I think I don't think there's any point in retrospectively mulling too much. But at the same time, we need to kind of move forward, but with clear strategies on what we, don't want happening. In a sense, kind of correcting that bit of regression that happened because of COVID.
So just to add one more point, and correct me if I'm, me if I'm wrong. With COVID, one thing has also happened is that, in rural areas, the girls were going to schools. Once they stopped going to schools, have parents sent them back to schools again or not?
See, that's a really, of course, there would, it's also a matter of they also grew up, they outgrew the schools in a sense. But I think the real struggle, like you've very honestly said, is how do we get girls to go back? And particularly, I think girls is higher education. that needs a lot of emphasis, because I think increasingly parents feel that, school kar liya, theek hai, at least 12वीं pass to hai. But that's not enough. And I think that transition from school to college and from college to workforce, that is so important for girls today. It is so important to be financially independent. And that value can only come from higher education.
While you were giving your answer, you also talked about the data which is available.
Right.
I mean, vis-a-vis gender and related issues, do we have enough data in the country? And I mean, what should be done in order to ensure if you don't have data, you don't have meaningful policies?
Absolutely. Absolutely. Data is such a big question in a sense. We have some data, but I think we need more, and we need more on the health system side. So we have a number of, we have the National Family Health Surveys. That's such a good resource for several health issues. There are also separate sort of state level data, because there are investments made through state technical support units. There are surveys that are going on. So there are several studies in like Bihar, UP, Maharashtra. There are several studies that have really shown the way. But what you need, and data is a sort of like, the question of data actually comes to a question of investment, right? A lot of times that investment comes from, donor organizations. Sure, that's good enough. But we also need investments from, the governments, and particularly the state governments. I'll say one thing, that we do have data, a lot of data on the sort of population side. We do need data on the quality of healthcare, right? That is,
and on social indicators.
Absolutely, because I think that is quite a big question today, is to understand, India has one of the largest insurance programs, for example, that. We did a recent study that showed that, the study was done with some Meghalaya data on insurance, and it showed, much like a study that had been done in Rajasthan earlier, that even in a state like Meghalaya, which we consider a fairly gender equitable state, we find that men are more likely to access tertiary care, and women are more likely to access secondary care. So again, this is a state that in many ways is a model state, but we are still seeing gender inequity. So what's happening at the level of healthcare and in women's access to healthcare? I think that is a question that we really need to understand.
So when we talk about health, we also need to talk about climate. Things are changing drastically, and women again are the most affected people in that. You have heat waves.
Absolutely.
They have to travel far to get water.
I know that is one of the most resilient images of.
Yes, and the pollution.
Yes.
I mean, we have Ujjwala scheme, but there are also rural households where still the traditional method of cooking is being used, and they're inhaling the gas day in, day out.
Right.
I mean, how do you see the relation between these two things?
So I think there is indoor air pollution, which you rightly said, that government strategies for energy and can really tackle. But there is also outdoor air pollution, which relates to larger policies of climate, to industrialization, to urbanization, what I think in our field we call the social determinants of health. So certainly that is the single biggest question. We know that it affects children. I think that is well known. There are studies that show that exposure during pregnancy can have impacts on the baby. And that again should be clinching evidence that we need urgent action. But the truth is that most of the interventions actually do not lie in the health sector. They lie with transport, they lie with industry, they lie with even agricultural policies. So it's so frustrating as a health person, because all I want to do is, as a health professional, and I think many health professionals feel this way, we want to fix the healthcare system, but how do we do that unless all these other sectors don't come along? So this is a real challenge today. I think not just that, I think now evidence shows that people, and not just women, both men and women, die much more prematurely.
Right.
And COPD rates have gone up, cancer rates have gone up. So we really need to, I think we really need to fix this situation. urgently.
So WHO has recently released a report that say breast cancer is increasing in women,
Yes,
and one of the reasons for that happens also to be sedentary lifestyle.
right.
And I mean, why do you have a sedentary lifestyle? You have pollution in
Yes,
big area. You can't go out. You
yes,
can't walk.
yes.
So I mean, those kind of infrastructural development also needs to take place.
Certainly, I think, but it's not just about being sedentary because of pollution. I think India has globalized and urbanized really rapidly, right? And while those are great things, I think we need to understand how those transitions have affected our daily life. So I think another challenge that, and it affects, of course, breast cancer rates have gone up, but it affects other cancers too, is water pollution, right? So pesticides in our food, in our water. So again, this is an intervention that needs health people to come together with agriculture people. But yes, I think if you talk about particularly women's health, cancer rates have gone up quite sharply in the past 10 years. Also, we are seeing in South Asian populations that many chronic diseases affect them much sooner compared to, like in their 40s or 50s, compared to 60s or 70s as they did in the West. So that has made us really question the models that we were working with, right? In NCDs, we were sort of thinking, okay, 60s, ab kuch hoga. But now we are seeing that young people, like in their
Yes.
40s, are getting heart attacks, for instance.
So that is what I was coming to
Yeah.
the next point when you talked about uh, people, younger people dying.
Yes, prematurely.
Prematurely. So, and it's not just about food you eat, but I mean, there's no awareness about,
Yes.
say, what kind of food intake you're having, right?
Right.
The product which you are buying from the market,
Right.
it might say it's fat free or low fat,
Yes.
but do we actually check the labels?
And we don't know how to read the labels.
And how to read the labels?
Right.
Is there awareness around that? Because I mean, there's rise in obesity, there's rise in
Yes.
cardiovascular diseases.
Yes.
Actually, what has happened is because of social media, a lot of misinformation is flowing. So people are saying that you eat
Yes.
this
Yes.
tablet, you lose weight in 15 days.
True, social media is the cause of a lot of misinformation, but it can also be the source of information, right? So it's the same instrument, it's the same technology, and we haven't been able to capitalize it as well as, let's say, some private sort of maybe companies, or even sort of, I think there are a lot of people who do talk about these videos of the 5 things to eat or the 5 things to do, and some of them might not be wrong, but certainly I think there needs to be a greater level of health literacy, being able to, and this is something that actually needs to happen at the school level. I feel like this is what high schools should be training young people to do, right? Because this is not something that you do when you're 40 or 50, but to be able to do simple things, to know simple, what is healthy, what is unhealthy, that kind of model is not there. And I don't know if there is a way to do this, honestly. I mean, at the university level, we often do this, but maybe we need to have public health learning at the high school level, maybe, I don't know.
Or maybe when you give midday meal schools, you strengthen that. I mean, you ensure that
Right.
children get to know what they're eating, it's proper calorie food, it doesn't have too much fat, all those things.
But that's what I mean, like this needs to happen early because it sets the norm for a person's lifetime, right? Like what happens. I mean, in a sense, we know from a lot of social norm research that whatever you learn, and earlier they used to think whatever you learn at 13 or 14, now they say whatever you learn at 8 is really formative for later life. So some of this literacy needs to happen at the school level. But again, we need to design a program, and again, not with maybe, a moral lens, but more of an information lens, right? Like that right information has to come in. Technology is a tool, but technology can be a very useful tool as well. So it's all about kind of the imagination, in a sense.
You've raised a very important point that we need to work towards it, but how do we do it? I mean, you have academia which is doing its own research, and
Yes.
the papers are coming out, but who is reading it? I mean, it's only reaching to
Ouch.
it's only reaching to a set
It's
of people
true.
who can read it.
It's true.
Then you have government which has its own set of people guiding
Yeah.
their policies.
Yeah.
Don't you think it's high time that all these groups come together and frame something which benefits all?
You are absolutely right, and unfortunately, that has been a major problem with our sector. Is that academics speak to academics, policy kind of gets framed often like with limited evidence, or at least we are not able to present evidence to policymakers in a way that they can use it, and then the community by the time is not benefiting often from what we're doing. So I think you have raised a really important question. I think there needs to be greater dialogue between, and I think we are culprits in a way, because by we I mean academia. I think we do a lot of studies and then we sort of do them for, because we are funded to do it, or we have that curiosity, or we need to know the answer. But we don't, I think, take that information back to the community in a way that can be used. And more donors actually are pushing academics to do that. And I think that is very important, because we are sometimes, and I feel very, I don't like it but sometimes people call us, you are ivory tower people. But public health professionals are generally not. We do a lot of field studies, there's a lot of field engagement. But I think we need to do a better job of taking our work back to the community. Right. That this is what we found, this is what we know. Because sometimes as researchers, we love to stay in that kind of bit of an ambiguity. Maybe I do know, but the answer is not clear, and confidence interval is like this. But we have to have some clear prescriptive answers. Similarly, working with academia with policymakers, very, very important. And then I think today, more than ever, we need to work with the media, because I think you all are much more powerful than we are. And maybe you cause some problems, but you can also solve those problems. So I think you are a lot more powerful than we can ever be.
And then also strengthen, as you said initially, that we need to motivate people more and more to do such kind of research studies, get them in the field.
I think that evidence process, we need to really think about, have we talked to enough people? Have we gotten, is there a reality check to the work that we are doing? But yeah, certainly I think we need a lot more dialogue between the two. But that dialogue can happen when we sort of, get off our sort of high horses, if I might say, and sort of engage with each other in ways that the other person can understand what we are saying. Because we are often, like, I can tell you, like, a lot of people I work with, often very highly statistical, right? But you have to convert that into numbers, into something that is easy for a policymaker who has like 10 minutes, 15 minutes to work on a problem. But I find, at least in our experience, especially the ways in which we've engaged with governments recently, I find that actually governments are very receptive. Like, if you give them the information in the right way, they are very receptive, and they are also very responsive. There are a lot of really bright people in the government. Sometimes you have to find them, but certainly they are very, very responsive if you present data in ways that they can use. So that is a real sort of challenge.
Thank you, Nandita, for giving us your time and talking to us. Thank you so much.
No, it's been a pleasure, and I hope that this was useful, and we have further conversations. Yeah, thank you.
Thank you.